think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Now, here's your host, Gerald Cooks.
Yes, welcome, ladies and gentlemen, on this 24th day of October, 2019. We're here with our co-host, Jay Basser, and our host, Jay Basser, tonight. And we're we're here with Dr. Bash, and he's going to have a guest on, and we're going to be discussing about back injuries, spinal cord injuries, and what have you, among other things. So be sure to take notes, and remember, we have these, we keep these broadcasts in archives all the time. So it's well worth going back and reviewing if you need to. So, Dr. Bash, how you doing tonight?
I'm doing good, and I'm glad that our friend Matt Hayes here with us tonight. You know, Matt and I were in West Roxbury in Boston VA hospital for, a few months about 35 years ago, and we never even knew of each other because he left a few weeks before I got there. But we had the same doctor and the same staff, and all of a sudden he resurfaced now with this spine injury, which hasn't been rated or assigned any kind of a code for 35 years. So Matt's now into the new system, since February, appeal system. So Matt, you want to tell them a little bit about yourself and maybe a little about what happened with the supplemental claim?
Well, I guess I've kind of, until I ran into you, I kind of stumbled along. When I first filed my claim, I was really just trying to get my medical records. It was at the VA Medical Center, and the volunteer out there actually wound up filing a claim, but it was a claim that you could have fit on a postcard. It just said spinal cord contusion, neurological impairment. So, of course, it was denied almost immediately, and then I went.
How long was that denial, Matt? How long was that denial? How many sentences was it?
Not very long. It just said, you only had like one visit. It didn't. But at that point, I really wasn't intending to file a claim. But it kind of points out when I get to the next step. When I went to the VA. Everybody gave me the name of somebody I talked over at the VA, and he was very helpful. But he filed a notice of disagreement, and so really the first claim that I filed was already an appeal, which was going to slow everything down. And that was so my claim was in May 2008. Then I filed the appeal in 2018, and then I filed the notice of disagreement in July of 2018. And then November, I went up to the VFW, and again, I was really just trying to get my medical records. And it was the end of November, and I spoke to somebody there, and like 2 days later, they turned out a really detailed supplemental claim. My notice of disagreement just kind of said neck injury, shoulder, hand, left leg, left foot, because all my neurological damage, as Dr. Bash knows, almost all is on my left side, which is unusual. People are used to seeing, somebody that's injured from the neck down or from the waist down. With me, it's all my left side, which is unusual. And even healthcare practitioners, even some physicians have a hard time wrapping their head around that. But then the supplemental claim was filed at the end of November, and that's actually been moved a lot faster than the appeal. That was the first decision letter came out July 1st, and a lot of the neurological injuries were deferred pending a line of duty determination. But it was really, the way I describe it to people is like it's sort of going from kindergarten to graduate school, because when I went to the VA and I filed a more detailed claim, I thought, well, I'm in pretty good shape. But then when I got to the when I sort of stumbled into the VFW and they went through my medical record, my in-service records, because I was hospitalized for 3 months. It was a much more formidable claim, but the problem is they're very helpful people. They're good people. They're hardworking, but they're not physicians. And so somebody, I was actually just in a conversation with somebody, and they mentioned Dr. Bash, and when I found out he had a neurological background, expertise, I didn't know how considerable it was at the time, but I thought, well, he's going to understand me immediately. So I reached out to Dr. Bash and included an impression of an MRI that I had, and he got back to me within an hour, and we spoke the next day, which was a Saturday, and I think the first question he asked me was, well, what hospital are you in? And I said, I was in Roxbury. And he said, Roxbury? I was in Roxbury. And he said, when were you there? And I said, back in 1984. And he said, 1984, that's when I was there. And I knew the next question was going to be, who was your doctor? It was the same neurosurgeon, Dr. Sarkarati. But then when, I guess in February, we were able to get together in D.C. while Dr. Bash was here, and we filed a nexus opinion. And then once you see the nexus opinion, you realize how, I hate to say how deficient the other claims were, but in point of fact, how deficient the other claims were, because then you have an exam, physical exam, and underneath that is, your medical records and your in-service records. But it's sort of it's a tiered approach. You have the physical disabilities, and then you have the regulations that underpin them, and then the case law underneath that, and it's just that's like what I refer to as, by then you're in graduate school, and it's much harder for it's not only much harder to deny, but it's much easier for the VA to understand what they're looking at. Because if you just look at the supplemental claim, which I've been told they're trying to get those done in 6 months now, but if you just look at least in my case, a supplemental claim, it was a little bit hard to understand because there was no narrative there. And he took a very broad approach. He went beyond just my neurological injuries and included tinnitus and some other things.
So Matt, what do you mean? The supplemental denial wasn't very verbose, right? There wasn't much in it. Is that what you're saying? The denial, the supplemental claim.
Actually, it's complicated because when they send you to external examiners, at least in my case, the first external examiner, a physician assistant back in September 30th, 2018, she didn't really, it was almost like going to a neurologist for an exam, only they're not really a neurologist and they don't really know what they're looking at until you get there. And so, for example, she had in her notes that my in-service records were silent about my injury, but I was in the hospital 3 months. I mean, I had a couple hundred pages, and then she said she identified my left hand isn't fully functional on my left foot, but said there's no connection. Well, the connection is the hole in my spinal cord, and so that was the first. The nexus opinion Dr. Bash submitted was really originally designed to correct that, but then when the supplemental claim was filed, it was filed under orthopedic, and I saw another physician, I had another C&P exam last summer, and the physician assistant in this case, I thought was outstanding because she had studied my medical record, she was familiar with my claim, and before I ever sat down, she said, your claims are a bit uneven because one was filed correctly as neurologic and one was filed incorrectly as orthopedic. And she did the most thorough exam that a physician assistant can do anyway. They're never going to be as skilled as a physician or somebody with Dr. Bash's background. But she was still on the ball. And then when I read the decision letter, September 13th, they had like 14 or 16 orthopedic denials that shouldn't have been in there. I've never broken a bone. So somehow the exam that she actually performed, both from an administrative standpoint and from a medical clinical standpoint, it just didn't get conveyed. And right now I'm trying to get. I had 6 C&P exams over a period of 2 weeks, and they all made it into my file except for that one. So you're always going to, maybe you're not always going to run into this stuff, but typically I think you run into a lot of this sort of thing. And there's a lot of people, one of the things that I would advise people is it's helpful, the more people you talk to, the better, because I made a call to the VA Medical Center, and I was just asking them to put me through to patient advocacy. And I bumped into whoever it was I got on the phone was when they tried to pull up my records, pointing me in the right direction. Because the sooner I can get that C&P exam, until I get that C&P exam, I can't really have Dr. Bash write a letter, because now everything has been attached to the to my appeal.
So Matt, if we go back and talk a little bit about where you think some of the major errors were, like maybe that first claim should have been more thorough, right? And the second supplemental appeal should have been more thorough.
Yeah, well, certainly. I mean, if I could, the problem with the whole claims process, or not really the problem, but the challenge. It's the first time you do anything, you don't know what you're doing, and that's why. I mean, if the sooner, the earlier you can work with someone like Dr. Bash, and especially Dr. Bash, in combination together with Bill Krieger, better off you're going to be, because there's a lot of things like the first when I filed a notice of disagreement with the VA, the VFW later told me that should have been filed as new information, a supplemental claim. So really the first claim I filed was an appeal, which is slower than the supplemental claims are. And so that was a mistake, but it was a mistake that I never, you walk in and, the person who's doing it is competent and as helpful as they can be in my case, in this instance, but they still, according to the VFW, they would have been better off filing a supplemental claim. And in fact, the supplemental claim that the VFW filed 4 months later, moved a lot faster.
Now that we're talking about
the VFW, but they made their own mistake, because I think that was the claim that was filed under orthopedic, which if I didn't bump into a capable physician assistant, I wouldn't have read the decision letter in September. I would have had no idea why there's all these orthopedic denials.
So Matt, now you're talking about doing a second letter, right? Second letter for me, right? We're talking about doing a second letter.
Yeah, well, just a second letter, but I have to try to get a hold of that C&P exam, because
yes, that's exactly right. So I can look at that and challenge it if I need to. So I want to bring this story out because in the new claims process, there's a lot of people out there that are wandering around the same way you did, And so if they get into the new process, which I don't like so much, I think it's just in the old one, but the new one, I might end up writing 5 letters now. I might write a single letter for the first claim, and I might write a supplemental appeal letter with new information, and we might do this thing called higher level review, and then do another supplemental claim with new information, and then do another high-level review, and kind of go through it that way, and then you have to go to the board. But those are a lot of steps in there. So patients need to understand that the new system is moving quickly. Like they might make decisions in a month on a supplemental claim, and that might only be one sentence when we submit 100 pages. But the idea is we'll just keep ratcheting up the data and polish the case up for the BVA if we have to. And that's kind of what we're doing with Matt. Matt's got that first letter from me, and now we're thinking about doing the second letter. But it's important to get the data. Like you said, if you get that CMP exam, I can look at that and see where there are things I can agree with and see where there are things I can say that they're off base on, and we can do some more testing. And that's where Krieger comes in too, because he can help us a lot with the legal part of it, the medical legal rules that apply. So that's right. It takes a team of people, and the system's pretty complicated. Maybe did Gerald and Jay have something to say about that? You guys have some experience with the new supplemental claims?
Well, Dr. Batch, I sort of run into the same thing with my CMP examination, because the examiner more or less looked at things in my favor, but when he submitted the report back to the regional office, they responded back to him trying to get him to alter it. I think I sent you that paperwork,
yeah, I see that a lot. The doctors write stuff, but then they have the rating team behind them, and they try and tell them that they have to rate it this way or write it that way, and so on and so forth. So I do a lot of times when I have patients and they go to an exam, I tell them wait in the exam room for civilian place until you see the report. If you told them you had foot pain and they don't put it in there, then make sure they put it in there. Or in the VA's case, get your exam report a couple of days later. If it's wrong, write it in and tell them that you want a new examiner, or you want to edit the report, because those reports are really important. If they're wrong initially, then it's hard to change, 6 months or a year down the road.
Oh yes, at least this examiner, CMP examiner I had, he did stick to his guns. He was a medical doctor, but I was surprised no, I really wasn't surprised that the regional office, the rater at the regional office would send it back to him and say, hey, why do you have to write it this way? And he said that's the way he was going to do it. And that's the way he did it. But I can see him altering or manipulating a CMP examination very easily, and the veteran not even know.
Matt?
Yeah. Over the years, I've had examples of that. Like I've had CMP examiners go in the room, and the patient might present them with my Nexus letter, and I've had CMP examiners leave the room and say, I'm not going to do this exam because it'll be like malpractice, because the rating team is trying to do the case one way, and my letter, based on data, is the other way. So those examiners are kind of in a pickle, in the middle, where they're getting squeezed by the administration versus the medical.
Dr. Bass, my original injury happened back in 1983, just a year before you guys. And me and the caller there, we've got basically the same issues. It took me 14 years. The worst thing that breaks my heart to see a veteran file a claim, and he goes to a organization for help, and somebody misfiles something or puts the wrong information, gets a wrong diagnosis or a wrong body feature. Same thing happened to me with another VSO. I'm not going to say their name because they're already famous enough for screwing up. But it takes years for a veteran to overcome that bad information. I had a spinal cord injury and a major neck injury, and the organization wrote it up as a traumatic head injury, and it took me years to change it. And back then, I didn't know Dr. Bash existed. If I did know, it'd been a different issue. But it took me 14 years fighting it, and I had to get an education to learn the entire system and just do that myself. So, but keep
That's
fighting,
a big,
man. Keep the faith. You'll get it.
yeah, it's a big deal. When you get that first information is important. And even in my case, you know, if they said it was a head injury and it was a neck injury, you know, that's a lot of what I do is change the diagnosis. But it's hard because I can say that, you know, I can prove it, but sometimes they want to validate it and recheck it. So it can be cumbersome. Like even in my case took 7 years, and I was at the military medical school, and my doctor wrote like 5 letters, and I was in the medical field. So, you know, I did maybe twice as fast, but still it took a long time to get it through the, you know, system.
You also have to realize too, over the years. I mean, when you get older, and you know you've had a spinal cord injury, you know, especially if you got muscle wasting. Like I've got atrophy in my arms and everything else. You can actually damage everything in your shoulder and your arms, you know, just by doing stuff. Because you know the muscles are there to protect it, but you know once it wastes away, it's gone. So. You know, there's other things that lead to it for later on for other issues. So.
Yeah, aging with spinal cord. That's why Matt saw me, because he was cruising along for several years, you know, and then also he started getting older and started having secondary complications and started to realize he might need some, you know, VA services. So that second muscle strength and aging is a hard problem with spinal cord.
Yeah, it is.
Bladder, bowel, lung function, skin breakdowns, all that stuff gets to be more of a problem.
That's good. I mean, you know, you just got a win here a couple weeks ago about bladder and bowel issue, don't you?
Did I get one from somebody? Yay.
Yeah, Mr. Powell. You know him, don't you?
Yeah.
Yep. So he's fixed.
That's good.
He's fixed me. He's fixed me pretty good.
That's good. It's good. You know, knock them out one by one. You know, like I said, a lot of it has to do with diagnosis. You know, like patients will get older and they think that their bowel and bladder problem is just due to age. Like I had a guy the other day that was voiding like 6 times a night, and even a lady, she goes, "That's normal, right, for somebody who's 50 years old?" No, that's not normal for a 50-year-old. You know, it's probably your spinal cord. You know, and they're leaking stool, and it's just normal for older people, right? No, the 80s, maybe 90s, but not 50s. So, you know. And so patients themselves sometimes will minimize the problems because they just get used to dealing with it. You know.
That's exactly true in my case.
What was it, Matt? What issue?
Well, bladder issues for one thing. But one of the other things I'd say about I would note about the supplemental claim. My supplemental claim, there were a number of things on there that I never would have thought to put on there myself, like asthma and tinnitus, and those were actually two things that were approved. The first 2 things that were approved, even though they're completely secondary to what I consider much more central issue, much more central disabilities that I have. But I stumbled into, I was sent to physicians who did they really studied my file, and when the VA sends you to if you see somebody for audio or respiratory or ocular, what the report they get back is definitive, and they basically make the C&P examiner makes the call. You know, it's a 50% or greater likelihood that it's service connected. If it is, then you're going to get a certain percent. What was much more challenging and why involving Dr. Bash is so important with the neurological condition is it was really all subjective. I mean, even the physician assistant that I saw last summer that I've had nothing but good things to say about, it was all verbal. I mean, she did some things that actually nobody had done before. Like when I first sat down and explained to her that, you know, people have a hard time really understanding it's my whole left side. and she measured my legs, and like my calves have 5 centimeters difference from my right calf to my left calf, and the norm is 2 centimeters. So she was thorough in that respect.
Thank you all for listening. That ends this show, and now I'm going to zoom off.